Okay, so I'm wearing all the appropriate PPE for my airway management attempt. For this video, I'm going to take the N95 mask off so you guys can hear better. So for a suspected COVID-19 patient, we want to be delivering oxygen to them if they need it. The best way to do that is probably with a nasal cannula up to 6 liters per minute and a surgical face mask over the top. If they need higher amounts of oxygen, we can move to a simple face mask or a non-rebreather. Simple face mask is probably less risk. Non-rebreather will potentially generate aerosol, so we want all our providers an appropriate level PPE. If the patient has arrested and we need to manage their airway, we need to do several things differently than we normally would. So first of all, the patient has a oxygen mask on for the purpose of this demonstration, which would be considered an aerosol generating procedure. Before we remove the mask, we want to turn our oxygen source off so that when we remove the mask, we're not aerosolizing particles into the environment any more than we already were. So we remove this. We're going to pre-set up our bag valve mask, and it's set up like this so that we have the face mask for the bag valve mask, a HEPA filter or viral filter, followed by our inline end-tidal CO2, our bag valve mask, and ideally a PEEP valve, which is not present on this. We want to start with probably a PEEP of 5 for these patients because they may require extra PEEP for oxygenation. We should use a 2-person technique for this. I would recommend that we do the double thumbs down technique. So as the mask holding person, I'm pulling the jaw up and forward and pushing the mask into the face to get the best seal possible, which will hopefully decrease aerosolization. So once we are prepared for our airway attempt, we've provided some oxygen and we remove this mask and we grab our iGel or King airway, a supraglottic airway. We're going to do this blindly so we don't spend a lot of time right in the patient's airway, because this again is considered an aerosol generating procedure. We remove the mask only from the bag valve mask and we reattach so that we minimize the amount of time that we potentially are generating more aerosol into the environment. So this whole time we need to be wearing all of our protective equipment. All the people involved need to be. We should plan this out as much as possible and anticipate this as a possibility so that we're not putting this together at the last minute. We could stop there.